see from a I've never talked to a hygienist about the different appointment types, so would love
So,
to.
there's always the new patient appointment types, and there's two different ways to do it. You can bring them in on their hygiene chair. Some offices bring them in on the doctor's schedule. They have a new patient chair. In the hygienist, all they do is go in and do their perio probing, do their oral cancer screen. Blackjack, I'm done. I'll see you at your. And then a preventive appointment is just your prophy appointment. Typically, that's 60 minutes long. You do perio charting, you update any X-rays, you do your prophylaxis, get the teeth clean, any adjuncts that they may need, like sealants or anything like that. You can knock that out in 60 minutes. We have perio maintenance appointments. So those are for people who have been through a gum infection therapy, through, scaling and root planing. They come in every 3-4 months because we have to we've treated the disease and now we have to maintain them. So we don't want it to rear its ugly head again. So they have to come in more frequently. Typically they're 60 minutes. The great thing about those appointments is they don't have to have a doctor's exam every time. And if they're doing their part at home, I'm not going to say easy appointments, but they're less complicated appointments. You're going to have to perio chart them every time they come in. And, we'll touch a little bit about that in a minute on how to break down that barrier on the time of perio charting, because that's time consuming. And then there's the scale and root planing, the perio appointments. Typically they, break them down into 2 quadrants of appointment, which, it depends on your hygienist skill. You can get through 2 quads in an hour, unless you're, if you're giving anesthesia, you might want to go a little bit longer. If you're doing all 4 quadrants, you're going to need at least an hour and a half at the very least, because that's a lot. That's, that's going in there, sandblasting below the gums, irrigating out, killing bacteria, doing laser therapy. You're going to need a little bit longer time. And again, it depends on your hygienist skill set. If they're right out of school, they're going to be slower than Christmas. I've seen hygienists that are just out of school. It'll take them 3 hours to do 2 quads. And you're like, but they pick up speed and they gain confidence and things like that. And then, you have your follow-up appointments after like gingivitis therapy, things like that. That's just, reprobe and polish. And those typically cost about 30 minutes. Shouldn't take too long at all.